afternoon. So first of all, Your Excellencies and dear colleagues, I want to thank you all for being here. It's a great pleasure to welcome you to this side event, which is organized by the Pasteur Network, Fiocruz, and DNDi. What brings us together today is a shared commitment and a shared conviction that none of us can address global health challenges alone. The fact that the Pasteur Network, Fiocruz, and DNDi have come together for this discussion reflects that commitment directly to working across institutions, across cultures, across countries, across disciplines, better to respond to dengue and many other challenges. We're meeting here in the context of the One Health Summit, and dengue is a very concrete example of why this approach matters so much to all of us today. As you all know, it's a disease that's expanding rapidly, driven by climate change, urbanization, and a range of environmental and social factors. And it's putting increasing pressure on health systems, particularly in countries who are already facing multiple challenges. But at the same time, we know that solutions exist. And there's been real progress in research, in tools, and in knowledge. But the question remains for all of us, how do we connect all of this to implementation? How do we do this at scale? That's really the purpose of today's discussion. We'll begin directly by hearing from ministers and senior country representatives on the front lines of the dengue response to better understand these realities of implementation. What are their biggest concerns? And from there, we'll move to questions of science and innovation, and how to ensure that advances actually translate into public health impact. As this conversation evolves, we will also look at what it takes to scale these efforts in terms of partnerships, financing, and ecosystems. In the second part of the session, I'll be joined by Michelle Childs. She's the Director of Policy and Advocacy at DNDi, who will guide us through a set of global initiatives that are already contributing to this effort in very concrete ways. And we'll close with a few key takeaways, followed by an important moment of partnership. So with that, it's my great pleasure to introduce Dr. Jarbas Barbosa, who is the Director of PAHO, to open our discussion. And let me also take this opportunity to warmly thank him for joining us today, given his schedule and his continued leadership in advancing regional and global responses to dengue. Thank you, Dr. Jarbas.
Thank you. Good afternoon. I would like to thank the Pasteur Network, Fiocruz, and the DNDi in collective action on dengue for the invitation to participate in this timely and important discussion. Let me begin with an initial reflection. Dengue is no longer just a tropical disease. It has become a global indicator on how environmental change is reshaping public health. Arboviral diseases remind us that human health cannot be separated from the health of our environment and the systems in which we live. Rapid urbanization, growing human mobility, environmental degradation, and climate variability are reshaping the conditions under which communicable diseases emerge and spread. Across the Americas, these factors create favorable conditions for Aedes aegypti, enabling dengue and other arboviruses to persist and expand in ways that challenge public health responses. Dengue remains the most prevalent arboviral disease in the Americas. In 2024, our region recorded more than 13 million cases, and let's remember that for each reported case, we estimated that we may have had 5 to 10 cases, so in the worst case scenario, we are talking about 130 million cases in 1 year. And over 80,400 deaths, the largest epidemic on record. At the same time, countries are facing concurrent circulation of dengue, chikungunya, Zika, sylvatic yellow fever, and neuropoach, further complicating surveillance, diagnosis, clinical management, and response. Climate variability adds urgency, altering mosquito breeding patterns and highlighting the importance of early warning and community-based prevention. Despite these challenges, the Americas have demonstrated remarkable resilience. Over the past decade, decade, the region has gained significant operational experience responding to emergency arbovirus. The rapid spread of chikungunya in 2013 and the Zika epidemic in 2015, including the identification of congenital abnormalities linked to Zika, showcased this capacity. More recently, the emergence of Europush virus and Sylvatic yellow fever beyond the Amazon basin underscore the arboviral threats continue to evolve. Surveillance systems established for dengue, Zika, and chikungunya have strengthened countries' ability to detect and respond to emergent virus in a timely manner. Collaborative surveillance strategies now support early warning response to yellow fever and equine encephalitis. At the Pan American Health Organization, we are convinced that integrating information from human, animal, and environmental health, particularly in expanding urban areas, can anticipate risks and guide rapid public health action. It has been more than 7 decades since IPARRO first called for the eradication of Aedes aegypti in 1947. At that time, probably this was an unachievable goal, but unfortunately now we are talking about controlling the mosquito. We will be very happy if you can control it, because all the changes in the environment, the urbanization, everything is very favorable to the mosquito than it was in the 1947 era. Today, the region draws on decades of operational experience, and we have learned that an effective response depends on strong primary health care. Early detection, timely clinical management, continuity of care, and community trust are essential to prevent severe disease and deaths during outbreaks. These efforts align with IPARRO's disease elimination initiative, which aims to eliminate more than 30 communicable diseases by 2030. For arboviral diseases, this requires integrated actions across surveillance, immunization, service delivery, environmental management, and social determinants, as well as equitable access to vaccines and health technologies. It also requires ensuring equitable access to vaccines and other health technologies as a core component of the response. IPARRO's Regional Revolving Fund, a mechanism operating for over 40 years, provides a key public good by enabling pooled procurement of affordable, quality-assured vaccines, medicines, and other health technologies, generating cost savings of 40 to 80% for the countries. This mechanism has been especially important for yellow fever vaccines, and is becoming increasingly relevant for dengue vaccines as countries consider how to incorporate new tools into comprehensive national strategies. Today, the integrated management strategy for arboviral diseases strengthens national capacities for preparedness, early detection, and coordinated response. It also serves as a platform for collaboration, linking surveillance systems, laboratories, clinical services, vector control programs, and communities. Countries are also incorporating innovation into their arboviral diseases response, leveraging improved analytics, collaborative surveillance, digital platforms, updated clinical guidance, and new vector control tools. IPARRO supported these initiatives through technical cooperation, knowledge share, and training, reaching over 800,000 health professionals in more than 160 countries via our virtual campus for public health. However, dengue prevention cannot rely solely on the health sector. The One Health approach requires coordinated action across local government, water and sanitation, education, environment, urban services, while engaging communities at the center of the response. The fight against dengue and other arbovirus is a shared responsibility. No single institution can face these threats alone. IPARRO welcomes the opportunity to deepen collaboration with the Pasteur Network, Fiocruz, DNDi, Collective Action on Dengue, and leading French institutions expanding joint efforts in surveillance, research, and capacity building. Ultimately, protecting health in a rapidly changing world requires not only knowledge and tools, but also commitment, partnerships, and sustained actions. Thank you.
Thank you, Dr. Barbosa. So now we'll move to our roundtable discussion, and it's my great pleasure to welcome our distinguished guests, both those present here with us today, and we have certain people joining us online remotely. We're truly honored by your participation. So I'd like to invite our leading panelists here to the room to please join us over here. I absolutely apologize. The people in the back, it will be difficult to see, but hopefully you can hear. Let me first start with welcoming our ministers. Minister Budi, who's the Minister of Health of Indonesia. Please come join me. As well as Minister Ibrahim Assi, Ministère de la Santé et de l'Action sociale de Sénégal. Merci. Because I will translate for the Minister of Health of Senegal, I think we'll start with Minister Budi and Minister Si to start off before I welcome our other panelists. So first of all, let me just say a few words to frame the discussion is what we'd like to focus on from both of you, given your current positions, is the reality of implementation, where we know there's a big difference between publishing an article in a scientific journal and transitioning from the results of that article into a viable public health policy. In addition to that, all of this in practice comes together in very different contexts. And this is where a One Health approach also can become both essential and complex. It can require coordination across sectors, alignment across institutions, and the ability to translate those priorities into concrete actions on the ground. So what we'd like to explore is something which is very simple, but also quite central, which is what does it take to strengthen dengue response in practice? And what are the main barriers that still stand in the way of making One Health approaches operational? So let me start and turn to Minister Budi first. First of all, Indonesia is a country that's been at the forefront of dengue response for many years, facing a high and sustained burden of the disease, while also advancing important efforts in prevention, surveillance, and innovation. So Minister Budi, from your perspective, how do you make the case to ensure that dengue, and more broadly a One Health approach, remains a national priority? Please.
Thank you, Rebecca. I don't know whether Indonesia is a front runner or one of the worst country in terms of incident, because if I see my list, tuberculosis every year infected 1 million people. Number 2 is malaria, 700,000, HIV 370,000, and dengue ranked number 4 in 160,000 in Indonesia. And I believe this 160,000 per year is quite high. I think it's only below Brazil. We rank number 2 or number 3, the worst, not the best. Rank number 2 or number 3, the worst globally. But in terms of death, tuberculosis 125,000, HIV 24,000. Dengue is more than malaria, although malaria incident is almost 5 times than dengue. So when we review the way we manage the dengue issues in Indonesia, there are two major issues. The first one is the underreporting of cases, and number 2, because our fatality rate is higher, then that is our hospital, the way we treat dengue is a problem. So in terms of actions, what we have done, first on the prevention side, we have done many years ago a normal factor control program, like the community-based effort on mosquito nest eradications, or one house, one supervisor to review all the mosquito larva controller. But starting 5 years ago, we started with a Wolbachia program in one city, Yogyakarta. And it dramatically reduced the number of this 1 million city area. And then 3 years ago, we expand into 5 cities to 7 million. And now we are planning to 100 city, 100 millions. We are still looking to fund this 250 million initiative to do the factor control in 100 cities to cover 100 million people. We also started with the vaccination program about a year ago. Now we are reviewing whether we would like to make it a national immunization program, because, like example, dengue is still number 4, we are already working on tuberculosis vaccine, which is #1 in terms of incident and #1 in death. We just would like to allocate our scarce resources money in where we would like to put the vaccination program. And second initiative is related with the surveillance. The surveillance, we have 10,000 primary healthcare clinics given to the previous president. The issue is the rapid diagnostic test is not 100% available. So what we are doing this year is to massively distribute the rapid diagnostic tests to all 10,000 primary healthcare clinics. The second initiative is we would like to complement this dengue testing surveillance with our initiative in tuberculosis. Before, we use gene expert machines, to do surveillance, and it is very expensive. With the help of the Gates Foundations and the Global Fund, we finally get approval from WHO to do a near POCT molecular biology testing. That each of device maybe cost only 2,500 US, and each of the tests maybe the cost is only 3 US. And it is a very similar complete PCR test, but it doesn't need laboratory setup. So even we can use a battery operated, and we already test 500 units last year, and this year we will deploy 4,000, and next year we will go to 10,000. So by next year, Indonesia will have a massive surveillance system using molecular biology testing, similar like PCR, in all of our primary healthcare clinics. Starting with tuberculosis and influenza, we will build the reagent for HPV DNA testing. And then the third after HPV DNA will include dengue. So the surveillance, that is what we are doing in across the 10,000 puskas. Now the third one is to improve the case management in the hospitals. Dengue is not a difficult case. In Indonesia, because we have a lot, we are expecting that the fatality rate will be low. Now it's still quite high. So what we are doing, we standardize the clinical procedure, a pathway across the hospital, train all of them. It's not supposed to be a very difficult case, and make sure that they have all the facility. We don't need a lot of facilities also at the hospital to take care of dengue. The target of zero dengue death by 2030 is not a slogan. I think it's achievable. Of course, from Indonesia, we have a very clear ambitions to reach the number. It just need a leadership and also very close working relationship with the animal health and environmental health, because I realized some of the city that used to have malaria now become a city with dengue. I always said in Indonesia, malaria is the village type mosquitoes or village type diseases. When they become modernized, many people, it become a city, not the mosquito transformed to transmit dengue. Dengue is more of the city problem rather than village problem. And because the urbanization, we realized that more malaria now become transfer into dengue. The urbanization of the mosquitoes is also happen. I would like to close that the mosquito is small, but dengue problem is small. It's actually a very, very big problem for all of us. That's why we need to have big ambitions and bold ambitions, and also a very fast response to make dengue death zero by 2030. Thank you.
Thank you very much, Minister Budi. I especially like the ending. The mosquito may be small, but the problem is very big. We should all perhaps remember that. Maintenant, je vais passer en français. Donc, pour cela, ministre Si, j'ai juste une question par rapport le même, en fait. C'est de votre point de vue, par rapport à la mise en œuvre, quels sont les principaux obstacles à l'opérationnalisation d'une approche One Health dans la réponse à la dengue, et quelles actions permettraient de lever ces barrières?
Merci beaucoup. Permettez-moi d'abord de remercier les initiateurs de cette table extrêmement importante. notamment le réseau Pasteur, Fiocruz, et l'initiative pour les médicaments, initiative médicaments pour les maladies négligées. Cela, d'autant plus que le Sénégal est quand même confronté à plusieurs épidémies d'ampleur qui permettent de partager quelques expériences et les défis. Il faut dire qu'au Sénégal, l'année dernière, la riposte à la fièvre de la vallée de Rift a permis de révéler une nouvelle facette. Et que la dengue est en train de circuler massivement au niveau du pays. Et la recherche active de cas a permis de voir que les cas de dengue ont été multipliés presque par 10, parce qu'on a eu à recenser 668 cas, avec des formes graves, notamment avec 43 cas, mais également 3 décès, même si il faut le dire que la létalité a été faite.
Oui.
Je voulais proposer,
Oui.
vous me laissez, je termine, comme ça vous pouvez faire un résumé.
Oui. Parfait.
Comme ça, on pourra peut-être gagner du temps.
Avec l'aide de vos fiches, monsieur le ministre.
Je vous donnerai ça. Maintenant, cette évolution de la dengue au niveau du Sénégal est reflétée par une intensification de la transmission, surtout dans les zones urbaines et périurbaines, parce que c'est des cas qu'on a rarement dans les zones rurales. Sous l'effet combiné, on a l'urbanisation qui est mal maîtrisée, on a les changements climatiques, aujourd'hui avec les phénomènes d'inondation, dans un contexte de manque d'assainissement urbain, mais également les conditions favorables aux vecteurs de l'AEDS. Et il faut dire qu'avec la réponse à la fièvre de la vallée de Rift, nous avons pu réaliser aussi une réponse multisectorielle et intégrée pour la dengue. Maintenant, pour revenir à votre question par rapport aux défis, il faut dire que c'est des défis extrêmement multiformes. Et le premier défi, c'est d'arriver à détecter de manière précoce. Donc la détection précoce, donc il s'agira d'acquérir des tests de diagnostic rapide des réactifs. Deuxième défi, c'est la prise en charge des formes hémorragiques, surtout le problème avec les banques de sang. Et on a été confronté à cette difficulté avec la fièvre de la vallée de Rift. L'autre défi, c'est la surveillance entomologique, parce qu'on a des entomologistes, mais de plus en plus des spécialistes qui sont très rares. Maintenant, avec la montée en puissance des maladies à transmission vectorielle, je pense que nous devons renforcer cette partie d'entomologie. Il y a aussi la question de l'interopérabilité des bases de données, avec la fragmentation des systèmes d'information. Il y a aussi le problème de la coordination multisectorielle, mais le problème du financement pérenne, parce que nous avons souvent des fonds d'urgence, on n'a pas des fonds qui sont toujours là et qui sont dédiés à la réponse. Malgré ces défis, il faut dire quand même qu'il y a des opportunités. Et parmi ces opportunités, nous pouvons citer au Sénégal l'institutionnalisation de l'approche One Health avec une coordination multisectorielle qui met en lien le ministère de la Santé et de l'Hygiène publique, le ministère de l'Agriculture, de la Sécurité alimentaire et de l'élevage, mais le ministère de l'Environnement. Mais de plus en plus, on a ajouté d'autres ministères comme le ministère de l'eau, de l'hydraulique et de l'assainissement, mais le ministère de l'Éducation nationale. Il y a aussi l'existence d'un programme de lutte contre le paludisme, parce qu'on sait un peu les modes de transmission presque similaires entre le paludisme et la dengue. Et les ripostes apportées au paludisme jouent aussi un rôle dans la réduction de la dengue, parce que quand on prend la distribution de moustiquaires imprégnés, quand on prend la lutte antivectorielle, quand on prend l'implication de la communauté dans la destruction des gîtes larvaires, à chaque fois qu'on a un impact sur le paludisme, on a aussi indirectement un impact sur la dengue. Mais de plus en plus au Sénégal, dans la lutte antivectorielle, on a utilisé des drones, parce que souvent c'est des mares qu'il faudrait un peu surveiller, mais qu'il faudrait détruire. Il y a aussi les capacités de recherche, avec une bonne collaboration avec les universités et les centres de recherche. Il y a les capacités de diagnostic, parce que nous avons des institutions comme l'Institut Pasteur et autres qui contribuent grandement. Nous avons aussi le renforcement de la surveillance avec l'initiative OMS à vos searches et la formation des émises. Nous avons aussi développé ce qu'on appelle les observatoires de la santé qui vont aider à faire une évaluation à temps réel des risques sanitaires pour une prise en charge optimale. On a de plus en plus aussi les essais cliniques vaccinaux par rapport à des maladies comme la fièvre, la dengue. Et on se réjouit beaucoup qu'au niveau de l'Institut Pasteur, qu'on ait le Diatropix qui peut aider à fabriquer des tests de diagnostic rapide qui prennent en compte cette question de la dengue. Il y a aussi comme opportunité les financements. Il y a l'État du Sénégal, il y a la Fondation Gate, il y a le Pandemic Fund. Voici un peu en termes de défis que nous devons relever, mais en termes aussi d'opportunités, parce qu'il y a quelque chose qui a été construit, il y a quelque chose qui a été bâti sur lequel on pourrait adosser une bonne stratégie de lutte contre la dengue au niveau du Sénégal et avoir beaucoup plus d'efficacité en mutualisant les efforts. Merci beaucoup.
Merci, Monsieur le Ministre. I'll provide a quick summary of the Minister's intervention in a far less elegant way than he's just done. But overall, in terms of Senegal, dengue represents an increasing threat for public health. There's been an increased number of cases from about 6,668 cases in 2025, which had 43 of the severe form of hemorrhagic dengue and 3 deaths, and it's been increasing. This evolution reflects this intensification of transmission, notably in urban areas and peri-urban areas, and that's combined with rapid urbanization, climatic changes, and environmental conditions which are favorable to the Aedes vector. What he discussed also was that the response was coordinated in a multi-sectoral and integrated fashion, and using an incident management system in the middle of November. And he discussed after that some of the challenges and also the opportunities in Senegal with respect to dengue control. So the first one, which is actually quite aligned with Minister Boudi's explanation, is the difficulty in terms of being able to have early detection of dengue and the tools which are available, either RDTs, ensuring the ability to have access to the reactives which are necessary for certain tests, the fact that there is a difficulty in the treatment, especially of hemorrhagic forms of dengue, and the need to use blood banks in order to do so. The next one in terms of the need for specialists who are doing surveillance, entomological surveillance, that's a capacity and training which is difficult to come by. The fact that data in between ministries, between departments, between groups is often fragmented and difficult to put together. They don't talk to one another. The need for multi-sectoral coordination, and the fact that financing is often not sustainable, that much of the financing is for emergencies and not necessarily for long-term financing. But the minister also mentioned the opportunities that Senegal presents, and some of the things that they've found have been successful in moving forward. The first one is an institutionalization of the One Health approach, which has a multi-sector coordination within the government. The second is Senegal has a long history of a malaria program, and the fight against, what do you call that? The vector control, and they have a long history of being able to deal with arboviruses, and in terms of other diseases which are similar, vector-borne diseases, and that learning which has occurred within the government, and especially the Minister of Health, has helped with response to dengue. The next is the fact that Senegal is quite rich in terms of research institutions and universities. We have the Institut Pasteur of Dakar, where its director is represented here by Dr. Sosé Fall. In addition to that, the diagnostic capacity, as well as there, also in Senegal, is the first, I think it's the first, diagnostic manufacturing plant on the African continent, Diatropics, which is something to be certainly saluted and hailed. In addition to that, the reinforcement that they've been able to put in place in Senegal with the WHO's surge surveillance, as well as all of the trainings. In addition to that, in Senegal, they've put together health observatories, which are cross-sectoral. And the minister made a specific note saying that cross-sectoral also involves the Ministry of Education, which is very right to mention that. Finally, in terms of ensuring that there are capacities to do clinical trials of new vaccines, therapeutics, and diagnostics, as well as a diversity of funding sources. So I was not perfect in my translation, but I believe I was faithful to what you wanted to say, Mr. Minister. So, yes. Thank you very much. I would like to also now invite some other members who are representing as well. They are representatives of their governments to come to the floor as well. We have Dr. Maria Lourdes, who is right here. Lourdes is the Vice President of Global Health and International Relations at Fiocruz in Brazil. We also have Mary Mudoni, close, who is the Principal Secretary at the State Department for Public Health of Kenya. Dr. Cornelius Schmaltz, he's a senior expert in the Office of the Deputy Head of the Health Emergency Preparedness and Response Authority, HERA, of the European Commission. And then we have two participants who are online. The first one is Dr. Visanyu Miyo, who is the Vice President of Thailand Science, Research and Innovation. And then we also have Dr. Rafael Valdez, who is the Director at the Center for Disease Prevention and Control at the Ministry of Health of Mexico. Buenos dias. It's a little, no, it's okay. It's 11 for him. So I want to thank you all for being here and joining this discussion. So I'm going to move over there, or I can sit. 1 second. It's easier. It's nicer. So I first, Mary, if you don't mind, if I'm able to start with you, that would be great. Yes. Yeah. So we've heard from Ministers Budi and Minister C from the perspective at the ministerial level from Indonesia and Senegal, but Kenya is a little bit of a different story. If you wouldn't mind, Mary, can you tell us a little bit about how Kenya is preparing to strengthen its response to dengue? And where do you see the greatest opportunity in terms of those efforts, or what you've heard today?
Thank you very much, Excellencies, ladies and gentlemen, good evening. Dengue in itself is re-emerging as a rapidly growing public health issue concerning Kenya, and not just in Kenya, but also across Africa. In 2024 alone, the Africa CDC reported over 191,000 dengue cases and 152 deaths across 15 member states. Yet, we know these figures must be interpreted as highly conservative. And in Kenya, dengue is frequently under-detected. It is misdiagnosed as malaria, typhoid, or other undifferentiated fevers. So our surveillance indicates that 20 to 25 to 35% of asymptomatic individuals in coastal Kenya show prior dengue exposure, pointing to a widespread silent infection. So what are we doing? Kenya is implementing a multifaceted strategy to improve its readiness. And the first thing is enhanced surveillance and diagnostics. We have seen that we have strengthened the integrated disease surveillance and response system to enable early detection and reporting of dengue cases at both facility and community level. The country again is adopting event-based surveillance, which proved very, very effective, especially during COVID-19 pandemic. And equally, we are scaling up the entomological and laboratory capacity. And this includes deploying mobile molecular laboratories for decentralized diagnostics during outbreaks. The second thing is hospital surveillance. And our KEMRI operates a clinical information network that spans 25 hospitals across Kenya to monitor nationally representative inpatient morbidity and mortality. Equally, the improvement of outbreak coordination, because to coordinate these rapid responses, we have operationalized the public health emergency operations centers, and that is across the country. We have devolved units, and health again is a devolved function in our country with 47 counties. So we have made sure that we have public health emergency operation centers and incident management teams. This ensures clear command structure and also the sectorial coordination between other ministries, ministries of agriculture, climate, and all the other ministries involved. We equally have community integration. We are utilizing the community health strategy by engaging community health promoters. Kenya has deployed 831 community health promoters across the country, and each community health promoter has been assigned 100 households. And these promoters support risk communication, early case identification, localized vector control, such as elimination of of mosquito breeding sites. And finally, we have we have global partnerships, which are signaling the readiness to deepen engagement with international research and development initiatives, specifically by expressing the willingness to join the Dengue Alliance. What is the greatest opportunity that we have for this impact? The Kenya strategic framework notes that the overarching greatest opportunity lies in the shifting away from reactive responses towards predictive, prevention-focused system anchored in community engagement and also multi-sectoral collaboration. Specifically, Kenya identifies several high-impact opportunities to enhance this, and one of it being strengthening the One Health coordination. There is a major opportunity in embedded dengue preparedness within the broader spectrum of national frameworks for disaster risk management and also climate health action. And this requires promoting deeper collaboration across health, environment, water, urban planning sectors, agriculture. Again, secondly, we are scaling up anticipatory action using climate data, which is by leveraging on the meteorological data and early warning systems. And we can predict outbreaks and trigger the preemptive vector control and community engagement before an outbreak peaks. Thirdly, we are investing in community-led vector control, sustainable mosquito control, which will depend on empowering communities to engage in continuous behavior change and, of course, environmental management year-round, rather than just during the active outbreaks. And finally, enhancing regional and global collaboration, as I have said before, because dengue does not respect boundaries. There is a critical need, ladies and gentlemen, to strengthen cross-border surveillance, data sharing, and research partnerships. There is no patient that belongs to Europe and another one that belongs to Africa. A patient is a patient. And finally, innovation. In diagnostics and digital surveillance, because expanding the use of rapid diagnostic tools and digital reporting systems can significantly close existing surveillance gaps and improve early detection. Thank you.
Thank you. So thank you, Principal Secretary. And it's very interesting to listen to for those of you in the audience because we hear some repeated themes over and over again. I'd like to turn to Dr. Rafael Valdez, buenos dias, who's joining us from Mexico, from Ceneprese. And if you'll allow me, Dr. Valdez, just to ask you a question. So first of all, we know that Mexico has developed a strong national approach to dengue prevention and control. We just heard the Principal Secretary discuss the importance of a preventive approach. And Ceneprese has been playing a key role in translating that policy into action at scale in Mexico. So can you tell us how you view public health systems can more effectively move from strategy, so to speak, to large-scale implementation?
Thank you very much, ladies and gentlemen, dear colleagues. It is a great honor to participate in this discussion on advancing dengue responses through a One Health approach. Dengue is now a rapidly expanding public health threat shaped by climate change, urbanization, and ecological transformation. In Mexico, this trend is particularly striking. Dengue cases increased by more than 140% in 2024 compared to previous year, reaching over 500,000 reported cases nationwide. In this context, sectoral approaches are no longer sufficient. We must strengthen the integration across disciplines, institutions, and levels of action, including human health, animal health, environmental, and urban planning sectors. One of the main challenges remains the fragmentation of systems, surveillance, vector control, environmental monitoring. On the other hand, the community engagement still too often operate in parallel rather than in coordination. In addition, a major challenge lies in translating scientific knowledge and innovation into operational tools that are truly usable by decision makers. Furthermore, inequalities persist in access to essential tools, whether diagnostics, early warning systems, or solutions adapted to local contexts. These inequalities are acute in rapidly urbanizing and resource-constrained settings. In the face of these challenges, partnerships are essential. No single institutions can act alone. We must build strong collaborations, bringing together public institutions, research centers, funders, and communities, supported by sustainable financing mechanisms to move from a reactive approach to a true prevention strategy. Within this context, we are pleased to announce today the launch of the SAFE Foundation, Sustainable Approaches for the Prevention of Emergency Zoonotic and Vector-Borne Diseases. This initiative is part of a broader collaborative effort involving international experts from the Pasteur Network, PAHO, and leading universities. This foundation, established in Mexico and hosted within Ceneprese, the National Center for Disease Prevention and Control, aims to strengthen an operational approach to prevention by linking research, public action, and community engagement. Its objective is clear: to transform scientific knowledge into concrete action adapted to local realities. In this context, one of the first initiatives will be the establishment of a dengue observatory in Mexico City. This observatory will serve as an integrated platform combining epidemiological, entomological, climatic, and socio-environmental data in order to anticipate risks and guide targeted interventions. Mexico City represents a particularly strategic case. As a high-altitude megacity undergoing rapid transformation, it is approaching a critically epidemiological tipping point in terms of dengue emergence. This situation offers a rare window of opportunity. Acting now before transmissions become endemic allows us to build proactive prevention systems rather than reinforcing reactive crisis response mechanisms once epidemics are established. The objective of this observatory is therefore to go beyond surveillance by supporting proactive prevention grounded in scientific evidence and integrated into public policies. More broadly, this initiative reflects a shift in paradigm from a reactive approach to an anticipatory one. In conclusion, improving dengue responses requires integration, equity, partnerships, and a long-term vision. Addressing dengue through a One Health approach means breaking silos, ensuring equitable access to tools, investing in partnerships, and translating science into anticipatory public health action. The One Health approach provides us within this framework. It is now our collective responsibility to make it fully operational. Thank you very much.
Thank you very much, Dr. Valdez. It was an important announcement, which is the opening of the SAFE Foundation, which you see behind me, and I'm sure that there are representatives here who are happy to answer questions after the event as well. So we're hearing sort of some repeated themes, but now if we also take a slightly different tack and we move a little bit more towards the role of science and innovation, which is thinking about not only what we already know, but to make sure that innovation itself reaches countries and communities where it's most needed, which is not often the case, and how we better connect the research tools and public health impact. And so I'd like to start with Maria de Lourdes. Lu, from your perspective, what practical steps can help strengthen the link between innovation, then implementation, and equitable access at a country level? Please go ahead.
Okay, thanks, Rebecca. First, good morning, good afternoon, good evening for everyone. I would like, on behalf of Dr. Moderator, that's our president and also president from Pasteur Network, to thank you very much. Otherwise, altogether, we could arrange and really organize this meeting. That's very important. And also extend our greetings to all authorities, to everybody, all our colleagues. And so I will speak a little bit about the Fiocruz experience and the Brazilian experience and how to translate research into public health practices. So addressing dengue effectively requires not only the development of innovative solutions, but also the timely implementation and equitable access across diverse populations. And this is a real challenge, especially in heterogeneous countries like ours. Despite significant scientific advances, translating innovation into effective action remains a complex and persistent challenge. This issue is particularly salient in the context of vector-borne diseases, which disproportionately affect low and middle-income countries with heterogeneous health system capacities, but not all, because we have the vectors spread globally, as Dr. Jarbas was approaching, and so therefore it's not anymore only a problem of our countries, but a global one. Against this backdrop, there's a clear need to strengthen the nexus between innovation, implementation, and equitable access across global, regional, and national levels, underpinned by robust local research and innovation capacity. So everything starts on research, on knowledge generation. To address this context, I would like to share some key points and Fiocruz initiatives. The first point is strengthening multi-sectoral collaboration platforms, as everybody was really talking about. So effective dengue prevention and response are inherently multidisciplinary, requiring the adoption of a One Health framework. But not only. Yes, strengthening multi-sectoral partnership, bringing together academia, policymakers, healthcare workers, community representatives, and private sector actors is essential to identify knowledge gaps, define public health priorities, and co-develop context-specific innovations, solutions at all. Such collaboration ensures alignment with policy agendas and supports coordinated implementation strategies, fostering shared ownership, accountability that are critical for translating innovation into accessible and sustainable interventions. In this context, Fiocruz plays a key role in advancing collaborative global initiatives, including the coordination of the WHO Fiocruz Collaborative Open Research Consortium for Flavivirus, and Ana Maria Restrepo, who is our coordination, is present here, the Global Coalition for Local and Regional Production, Innovation and Equitable Access, whose executive secretariat is led by Fiocruz and has identified dengue as a priority. as well as its engagement in Dengue Alliance, Collection Action for Dengue, and other initiatives. Open access platforms and collaborative forums facilitate the exchange of knowledge, best practice, and lessons learned across regions, supporting continuous improvement and scaling up of effective interventions. The second point we would like to highlight is integrating science, technology, and innovation into public health strategies. So at the national level, effective policy frameworks that integrate science, technology, and innovation into public health strategies are absolutely essential. Otherwise, we are just publishing papers. Government should promote the uptake of research finding into routine practice, thereby bridging the gap between innovation and implementation. This approach enables the continuous refinement of strategies to maximize reach, effectiveness, and equity, particularly among vulnerable and underserved populations. Public health systems must also be intentionally leveraged as platforms for implementation in Brazil. The unified health system operates at a national scale, with strong territorial capillarity and a demonstrated capacity to translate innovation into routine public action. Accordingly, dengue response in the country is not based on isolated initiatives, but on a national strategy and coordinated approach that connect to primary health care, laboratory networks, health and environmental surveillance, and community engagement within the Unified Health System framework. The Brazilian experience with the Wolbachia approach provides a compelling illustration of this model. As a partnership between Fiocruz, the Ministry of Health, and the World Mosquito Program, this initiative was successfully transitioned from research to policy implementation in the public sector. It's currently being carried out or approaching advanced deployment phases across multiple cities, reflecting a carefully planned and systematic scale-up process. This experience demonstrates that the innovation is embedded within a robust public health system and supported by adequate governance and funding. It's also another point we will highlight. Large-scale implementation becomes not only feasible, but sustainable. Relevant experience in surveillance fields includes platforms developed by Fiocruz to anticipate and forecast epidemiological scenarios and trends. And it's a lucky and an asset to have national systems. So we have national data, and this is really a challenge for many countries that they're not able to really see the national situation. These tools are already integrated into the Brazilian Unified Health System, supporting evidence-based decision-making and strengthening timely public health responses. InfoDengue enables the integrated analysis of epidemiological and climate data on arboviruses, supporting and monitoring the prediction of incidence and trends through nowcasting approaches. And by the use of many of these platforms, we have a huge epidemics in Rio de Janeiro, for example, in Brazil in 2024. And the lowest mortality occurred in Rio de Janeiro, where everything was modeled, controlled, and so on. So we were able to anticipate the interventions. ISOP is another system, another platform that was developed in Fiocruz and adopted by the Ministry of Health. It's an anticipation system for outbreaks with pandemic potential. It was designed for respiratory viruses along COVID-19 epidemics, but it's also now can be adapted for any kind of pathogen. And dengue is the next one. And so it's exactly dealing with big data. So it integrates multiple data set sources to support early detection of potential outbreaks and enable prevention action by combining data from primary healthcare, pharmaceutical sales, genomics, wastewater we will include as well, and social media for syndromic surveillance. The third point is promoting policy frameworks that prioritize equity and community engagement. Ensuring equitable access requires targeted policy measures to address structural inequities in intervention delivery, including the social determinants of dengue, susceptibility, and access to care. Embedding equity metrics within monitor frameworks strengthens accountability and guides resource allocation toward marginalized populations. Promoting affordable and culturally appropriate innovations enhance uptake and sustainability, while the meaningful inclusion of civil society in decision-making reinforce representativeness and participatory governance. Moreover, engaging communities as active partners in research improves the relevance and acceptability of innovations, as participatory approaches enable affected populations to identify priorities and co-design context-sensitive interventions, thereby supporting sustained impact. Ultimately, advancing equity requires a commitment to the principle, nothing about us without us. So it's in the core center of decision-making in Brazil. The civil society also decides together with the Minister of Health which will be the priorities, and it's really an asset and we are very proud about it. Fourth, I'm concluding, yes? But it's a very good opportunity to discuss, is strengthening human resource capacity for improved dengue response. So, strengthening human resource capacity requires emphasis on interdisciplinary training that integrates biomedical science, data analytics, public health, and community-based approaches, but not only this. Developing a skilled workforce is foundational to this effort and can be advanced through targeted investments in scholarships, specialized training programs, and partnerships with international centers of excellence. In this context, Fiocruz Merrier Foundation and Pasteur Network is jointly developing an integrated arbovirus management training program, a comprehensive initiative to strengthen global capacity for the prevention, detection, and response to arboviral diseases and emerging pathogens. The program integrates key domains such as epidemiology, clinical care, vector control, surveillance, public health policy, and community engagement within an internationally aligned framework. Collectively, these efforts enhance local expertise, ensuring the contextual relevance and responsiveness of research, innovation, and their effective implementation. And last, but not least, financing and incentive mechanisms. Sustainable finance models, including government budgets, international aid, and public-private partnerships, are critical to support the entire innovation pipeline, since research, development, implementation, and monitoring. Additionally, incentivizing local innovation through grants, awards, or tax benefits encourages the development of solutions tailored to country-specific challenge. So, the question is, we don't need only funding during epidemics and pandemics, and then adios, it was a pleasure, but then the resources are just falling down. We need sustainable action all time, sustainable to be prepared for the next epidemics, the next pandemics, because the question is not if, is when. And we should be prepared to don't live again what we had lived along the COVID-19 epidemic. So in conclusion, bridging the divide between innovation, implementation, and equitable access requires concerted, context-specific efforts at the country level. Strengthening local research and innovation capacity forms the cornerstone of effective dengue response, enabling the generation of tailored solutions, their application to real-world settings, and equitable distribution among populations at risk. By investing in human capital, infrastructure, multi-sectoral collaboration, community engagement, and sustainable financing, countries can build a resilient system able to mitigate dengue burden and enhance health equity. This integrated approach contributes to more effective, inclusive, and sustainable public health outcomes. So thank you very much, and I'm sorry for a long exposition, but necessary.
Thank you. Thank you, Lou, for that. Long but important. We have mosquitoes are small and the problem is big. Nothing for us without us. and an assortment of other lessons already to take away. So I'd like to turn now quickly to Thailand. Thailand has been actively contributing to dengue research and innovation, particularly in strengthening the link between science and public health application. And we have Dr. Visano Miyu joining us online. And welcome, and thank you for being here. It's a little late for you, so thank you for taking the time. So the question that one second. The question we wanted to ask was that are there recent advances in dengue research that you see as having the greatest potential to improve outcomes, and how can we accelerate those impacts?
All right. Thank you very much. Thank you to the organizers, the Pasteur Network, Drugs for Related Diseases Initiative, and Fiocruz for bringing us today together to discuss dengue preparedness through a One Health approach. I think I'm very honored and very excited. It's quite late, but I try to be with you guys for the whole evening. So to speak on behalf of Thailand Science Research and Innovation, TSI, which is the national agency responsible for setting science, research and innovation priorities and allocating research budget to address national challenges. For Thailand, dengue remains a major public health threat shaped by climate, environment, and rapid urbanization. Dengue is not only a health issue, it is a national priority linked to a long-term resilience, economic stability, and health security. Since 2020, through TSI, Thailand has supported 183 dengue-related research projects, with a total investment of approximately $18 million, covering the full value chain from vector control and diagnostics to vaccines and community interventions, ensuring a comprehensive and coordinated approach. From Thailand's perspective, three recent advances have the great potential to improve dengue outcomes. First, biological vector control, particularly Wunbanchai-based approaches led by the Faculty of Tropical Medicine, Mahidol University, in partnership with the Department of Disease Control, Thailand, and World Mosquito Program, has shown strong impact in reducing mosquito transmission at the community level. This is a practical example of how environment and biological solutions can support dengue prevention. Second, digital surveillance system, such as Thailand's Tanrabat platform. This is in Thai name, means to prevent from the spread out. Developed by the National Electronics and Computer Technology Center in collaboration with the Department of Disease Control Thailand, are improving early detection and enabling faster response at the local level. Timely data is essential for preventing outbreaks from escalating. Third, the next generation vaccines and diagnostics, led by Chulalongkorn University Vaccine Research Center and Mahidol University Vaccine Research and Development Center, are advancing rapidly. In Thailand, several vaccine candidates are progressing through development stages, while new diagnostic tools are moving forward, validation and industrial readiness. An important gap that remains the lack of specific, widely accessible dengue treatment. While prevention through vector control and vaccine is essential, many countries, including Thailand, continue to face high burden of cases each year. Effective treatment options are therefore critical to reduce disease severity, prevention complications, and save lives. As highlighted by the World Health Organization, strengthened care management is a key pillar of dengue control. However, current care is largely supportive and underscore that urgent need for safe, effective, and affordable therapeutics. We acknowledge that advancing dengue treatment will not only improve patient outcomes, but also reduce pressure on health system during outbreaks and strengthen overall preparedness. Another key challenge is translating research into a real-world impact. While research capacity is strong, fewer initiatives are designed for focus on a large-scale development. Strengthening implementation pathways, regularly alignment pathways, and ensuring equitable access to new tools remain critical priorities. To address this gap, Thailand is focusing on scaling community-level implementation, integrating innovation into health system, and strengthening collaboration between researchers, public health authorities, and local communities. This includes shifting from project-based funding to more programmatic, mission-oriented approaches that support scale and sustainability, supporting R&D. Collaboration is essential. Dengue does not respect borders, and preparedness depends on shared knowledge and coordinated action. Thailand, through TSRI and leading institutions such as Raj Hospital, Mahidol University is working with partners, including DNDi, to support collaborative research on affordable and accessible dengue treatments. No country can do this alone. Collaboration is the key. Together, we move toward our shared goal of zero dengue deaths and stronger health security for all. Thank you very much.
Thank you. Thank you for taking the time and also for staying up a little later than usual. I just want to finish right now in this part of our side event with Dr. Cornelius Schmaltz from HERA. And HERA plays a key role in strengthening health emergency preparedness and supporting the development and deployment of medical countermeasures. And so, Dr. Schmaltz, how can partnerships and financing mechanisms be strengthened to support scalable and sustainable dengue response? We've heard quite a lot about the financing angle. If you could share your thoughts, that would be great.
Thank you very much. It's an honor also for me to be here. Thank you very much for the invitation. It's a bit easy for me to skip some parts because much has already been said. I'll try to not repeat things. But for those of you who are not familiar with HERA, wonderful acronym, it stands for the Health Emergency Preparedness and Response Authority of the European Commission, which is the Directorate General of the Commission that really bundles and focuses the expertise in medical countermeasures. HERA covers medical countermeasures throughout the entire value chain, from research and innovation to manufacturing, procurement, stockpiling. This is what we hope to be good at and where we spend our budget also. Dengue as part of the vector-borne diseases and the diseases with animal reservoirs is very much in our focus. We have just issued a new threat prioritization document, which specifies what we focus on, what we spend our money on. And this category of vector-borne diseases and diseases with animal reservoirs is in view of all the factors that have been named several times here: urbanization, climate change, etc. One of the sectors on which we focus very much. As has also been said, of course, this is a prime example of the One Health approach. I don't think I need to repeat this. And we're very much aware that HERA cannot do this alone. Nobody can do this alone. We've also heard this. Partnerships are vital. And maybe just as an example to show you how much they are part of our DNA, they are set up in our governance mechanism. We have not only a HERA board that represents all European member states. We also have an industry cooperation forum because we realize that cooperation with industry is absolutely essential. And we have a civil society forum, which brings in civil society actors that we need to implement our mission. In dengue, it is very clear that this is moving very rapidly in Europe from just a decade ago, a few imported cases per year to now sustained autochthonous transmission clusters during the season. But we see, of course, the threat of dengue globally, the massive burden of disease that we've heard about from many of the contributors to this discussion. And therefore, it is also vital for us to benefit, of course, from the experience and expertise of these countries from which we hope to learn and benefit. And you've seen that I've taken ample notes here to carry home and to really bring this experience. Finally, maybe a final thought on partnerships. In the current geopolitical situation, it is very clear that strategic autonomy and European competitiveness are now much more than 5 years ago a key concern for us. Yet this absolutely does not exclude, it actually mandates us to seek effective, equitable and trustworthy partnerships where our interest aligns very much with those of partner countries and institutions and where collaboration is mutually beneficial. This concerns all areas. It concerns intellectual property, tech transfer, local manufacturing and access to clinical trial networks. Nobody is safe until everybody is safe. That's one saying we haven't heard today, but it remains, of course, a key paradigm of pandemic preparedness for us that obliges us to build such alliances for the benefit of all of us. In this context, finally, I'm happy to say that HERA has done a lot of dengue. I'm not going to list it all, but what I want to celebrate here tonight in particular is that with the Agence Française du Développement and DNDi, we have identified, we believe, the right partners for the development of small molecule dengue antivirals. We have just signed a 20 million euro contribution agreement at the end of 2025 with AFD, and which involves DNDi as a key partner. And we hope that this sets an example of such a mutually beneficial cooperation. Jointly, I think these partnerships, that's what just my predecessor has said, really we need them to fight dengue and to achieve our goals. Thank you.
Thank you, Dr. Schmaltz, for that. And that was a very important recap and essentially moving right to the essence. And congratulations as well. Having a treatment for dengue would certainly be an amazing accomplishment. I want to just quickly, there's an intervention as well. We have Cécile Bilot, who's here, who's the head of a unit at the European Commission's Directorate General for International Partnerships. And I believe she just wanted to share a quick intervention.
Thank you very much. Yes, I'm a colleague of Cornelius, but working in another department. So we have other tools and other things. But I think this was interesting, as Cornelius was saying, to hear about the financing needs and the need also, I think, to work on financing with different actors, because there's not one actor who has the full solution for financing. So that's something we are trying to develop more and more. I wanted to mention that we have one tool currently called HDX, Human Development Accelerator, which is meant to support research and manufacturing. And it is based on either blending, so loans plus a bit of grant guarantees. So really working with other actors and other banks to guarantee and to de-risk. Or we have also volume guarantees as the free tools under this mechanism. It's together with the Gate Foundation and the EIB, not BB, EIB. But we've seen also for research many projects, it is not always the right tool, because as I think many were saying, grants element, especially early in the project, is needed. It's not enough to have the loan. So that's something that we are noted and something that we will continue to work. But I think on that also, working with the others actors and trying to put us together around things that are important and impactful disease like dengue, which you're talking about, would be really important as we move on. That's it. Thank you.
Thank you. And we'll end this session with two brief interventions, one from Minister C and the other from Minister Boudi, because they're on the hot seat every day in politics. So we can end with them. Monsieur le Ministre, si vous avez de faire une action ou bien un engagement concret pendant les prochains 12 à 24 mois, est-ce que vous pouvez nous expliquer un peu qu'est-ce que ça va être? Sur la dengue, bien sûr.
Merci beaucoup. Je pense que c'est une très bonne question et qui vient à son heure. Le Sénégal vient d'avoir le financement avec le Pandemic Fund et nous nous préparons à mettre en œuvre cet important appui. Et nous nous préparons aujourd'hui à faire face concrètement avec ces financements à toutes sortes d'épidémies qui peuvent survenir ou de pandémies. Mais comme nous avons eu l'année dernière la fièvre de la vallée du Rift, mais également la dengue, nous voudrions bien que ce soit les premières expériences que le Pandemic Fund aura aidé à réduire ou bien à lutter à lutter contre. Ça, c'est un premier point, mais il y a une série d'actions. Je ne sais pas si on a un peu de temps. Maintenant, la deuxième action, c'est le renforcement global des systèmes de santé. Il ne faut pas se leurrer. Si on n'a pas un bon dispositif de laboratoire, on n'a pas un bon dispositif de surveillance active, on n'a pas des ressources humaines de qualité, on n'arrive pas à relever nos plateaux techniques médicaux, quels que soient les financements que nous aurons, nous ne pourrons pas lutter durablement contre les épidémies et les pandémies. Et ça, c'est un des objectifs majeurs, et c'est une des priorités aujourd'hui du ministère de la Santé et de l'Hygiène publique au niveau du Sénégal. Maintenant, pour conclure brièvement sur l'approche One Health, moi, je ne suis pas un medical doctor. Je suis de formation géographe de la santé, mais qui a travaillé beaucoup sur la santé publique, qui a fait l'épidémiologie spatiale, qui a fait l'épidémiologie environnementale. Moi, ma perspective par rapport à l'approche One Health, ce n'est pas seulement de se limiter au dialogue intersectoriel. Secteur de la santé, secteur de l'agriculture, secteur de l'élevage, secteur de la pêche ou secteur de l'eau et de l'assainissement. Mais il faut que les maladies arrivent à dialoguer et savoir que nous, quand on est en face d'un problème de santé, mais on soigne des personnes qui font face à une maladie, mais qui a une origine multifactorielle. Et en soignant la personne, mais on est aussi dans l'approche One Health, parce que si on a le paludisme, on a la bilharziose, ou on a une autre maladie comme la dengue, on ne peut pas dire que le financement que j'ai obtenu ne verra qu'à financer des actions contre la dengue, mais il faut avoir une vision beaucoup plus holistique. Donc, il faudra élargir davantage le concept de One Health pour évoluer d'une approche intersectorielle à une approche intermaladie pour prendre en compte le bien-être et la santé des populations. Merci beaucoup.
Merci. Okay. Wait. I have to remember. This was long. No. I'm just going to resume. So the minister was explaining a little more than one action, but several actions. Minister C. The first one was to take the lessons that have clearly been learned with respect to the Rift Valley fever outbreak, as well as others in Senegal, and to essentially not start from zero, but to use past experiences to help with the future. The second, which may seem obvious to everyone in this room, but unfortunately is not, which is strengthening the health system as a whole in its globality. The third, and I'll try and translate it directly because he was very funny in explaining this in French. It was nice. He said right away, well, I'm not a medical doctor, but he has a long experience in medical geography, as well as in epidemiology and in public health as a whole. And the final point that he wanted to make is, and which is absolutely the case, which is when someone is sick from one disease, it's not just about treating that disease, but treating holistically both the person and thinking about the fact that there are always different aspects which come in, and looking at this in its globality, and that when we invest in dengue, we also invest in people. And it's not just a question of thinking about the disease from one aspect, but from all of the aspects as a whole. So thank you. And finally, Minister Budi, what would you do?
Because this event is a One Health event, and I learned that One Health consists of human health, animal health, and environmental health. So Indonesia will do two actions instead of one. First one is related human with animal. You mentioned about politician, like both of us are politician. Handling human, it's much more complicated politically, socially, ethically than handling animals. So that's why learning with Indonesian experience and Brazilian experience, we understand that we can do healthcare intervention not only at the human level, but also at the animal level, especially on dengue. We have successful 1 city, 1 million populations, expand to 5 cities, 7 million populations. So the first program that we commit to do is program Double 100. So we will implement in 100 cities 100 million people for Wolbachia programs. This is the intervention at the animal level, at the mosquito level, not at the human level. And we have seen Brazil is quite advanced in this one. So that's why we are very convinced that we will do it. 100 city, 100 million protections, and we just need to gather around 250 million funding. So the lady that's sitting there mentioned that yes, she has a lot of money. I will be very happy. She's busy with the handphone, but I will be very happy if she can contribute some of the money or donate the money to Indonesia. So that is the first program. The second program is about human to environment. Again, I'm like him. I'm not a medical doctor. I'm a nuclear physicist by training, 30 years as working in banking, used to run the largest bank in the country, and then suddenly during COVID, I don't understand why, the president decided to put me in as the first non-medical doctor as Indonesian Minister of Health. So what I learned at that time, there is an alpha variant in COVID, and then beta, and then delta, and then omicron, which I don't understand what the hell they are. You know, mutation, genomic, etc. And then I do realize that in infectious disease, somehow some pathogen can mutate. And I strongly believe environment play a role in it. So when I joined Indonesia, we only have one city with one genome sequencing capacity, less than 200 a year. Then now we have 16 region, 20,000, and by the end of 2037, 38 states will have 100,000 genome sequencing capacity every year. And I remember at the time, the cost of whole genome sequence is close to 1,000, reduced to 200, reduced to 100. Now, last week, I met with somebody that can offer the whole genome sequence 3 billion pair with $50 US. So the cost is also closing in. Now, what the second program that we would like to do is learning from COVID, learning from PCV vaccine. When I came, PCV vaccine is 10 strain on serotype, and then increased to 13, increased to 15. Somebody come to me, 20, 21 now, the same as HPV vaccine, you know, come with 5 and then going to 9. So this environment play a role in changing the complexity of handling a pathogen, handling the pathogen. So that's why we are committed to deploy a massive genome sequence capacity from one city to 16, now will be a 38 by the end of 2037, and increase our annual capacity for the whole genome capacity from only less than 200 to 20,000 now, and will be 100,000 in the next 2 years and 500,000 a year in the next 5 years. And with Brazil, we came together in Bali in 2024 in Arbovirus Convention with Nisia at that time. Indonesia and Brazil was the first two countries that initiated the dengue genome sequencing data sharing. So we start learning from COVID, do a surveillance, genome surveillance on dengue, and share the data internationally through GIS8 platform. So I do hope with this initiative, for whatever type of mutation happens in the near future, we are ready with the diagnostic, ready with therapeutics, and also ready with the vaccine. Thank you.
Thank you. So I want to thank all of our panelists, as well as Dr. Valdez and Dr. Mio, who are here with us online, one very early, one very late. Thank you both for being here. And I would like to invite our panelists for one last round of applause from the audience. And thank you very much. And to hand over to Michelle Childs, who will guide us through the final part of this session on 3 very important strategic initiatives. Michelle is the Director of Policy and Advocacy at DNDi. So please, Michelle. Thank you.
Thanks, Rebecca. Thanks, everybody. So, I mean, I think we often see written that dengue is going across regions and we need to talk across regions. And I think we've just had a live example of the importance of bringing people together to share their experiences. What I'd like to do in this session is to talk about moving from the political action and the financial action to some specific initiatives. We've heard throughout some of the interventions, some of the initiatives that have been set up, but we wanted to focus just on 3. And I would also encourage the people who are online, because I know that there are many people who are working in this area, to also share any initiatives that you're involved in so that we can also use this as an opportunity to share information. But if I may, can I ask, we have 3 panelists who will come and talk to us, one of whom is online. So can I invite Kevin Tesi to come and join us, and Dr. Marco Nascimento to come too. And we are should be joined online by my colleague, Dr. Isabella Hebero, who today is wearing a hat as co-chair of the Dengue Alliance. Just so that people are aware, because this has been quite a long discussion, what we'll do here is we'll have a short discussion about these different initiatives. We'll then have a very short wrap-up, and then a final event of a signing, and then you get to talk to each other and talk to us as well. So, if I could first turn to you, Kevin, and I think what you are kind of here to talk to us about is what you can tell us about the initiative, and share with us really what you think this initiative can do, why you think it matters, and do you think that it could be scalable or shared with others? Kevin.
Hello. Thank you very much for the invitation. I'd like to thank the panel that went ahead. It was a really exciting conversation and discussion about what's going on at the country level, which is really key to what I'm going to talk about in a moment. So, the Collective Action for Dengue, or CAD, is an initiative which is a neutral organization, it's a neutral initiative which is focused on multi-sectoral sort of partnerships. It's a global coalition of around 50 different organizations which have pulled together out of COP28, which is really a roundtable discussion which really ended up building into something a little bit more important. As I said, we're relatively new, but we really wanted to focus on trying to align fragmented dengue initiatives, and a lot of conversations beforehand talked about a lot of the initiatives that are going on in country, talking about how more communication needs to be had between different government departments, and there was even a final discussion talking about the cross geography discussion between Brazil and Indonesia. And I think one of the things that we're trying to do, one of the things we're trying to do on the CAD is really trying to pull all these different organizations together. We've got about 50 different members, and that's kind of one of the things we're trying to push through. Our secretariat is the Pasteur Network. We're organized. We have a steering committee which I lead together with Paula Regis, who I don't think is here. Oh, okay, that's a shame. And so what we're really trying to do is pull together all these different multilaterals, governments, innovators, various initiatives from academia as well. And it was really encouraging to hear, I'm trying not to repeat what went beforehand, but it's really encouraging to hear a lot of the discussions around financing, around innovation, around really trying to bring together different stakeholders to be able to drive this sort of forward. So in terms of what the CAD is, this is where we are. We're a relatively nascent organization, really trying to pull together and be an advocate for how we can pull organizations together.
And if people were interested in being connected to the CAD, what do they need to do?
Well, talk to me, talk to the Pasteur Network. I think one of the things about, if you want to be interested, is there was a lot of discussions going on earlier on about the importance of dengue. one of the things I was going to highlight was the fact that Africa is one of the countries that has been underrepresented in the dengue landscape. And it was really good to hear the Principal Secretary talk about that, and also Senegal talk about the importance of understanding what the scale of dengue is in that space. And I think as we hear all the initiatives that were going on in the different countries, really trying to understand how that can be brought to play in places like Africa, where, and this was touched upon by some of the ministers, is the idea that when you're looking at dengue, you're not just looking at one disease on its own. You're looking at dengue in the context of malaria or other arboviral diseases. And that puts pressures on health systems, that put pressures on healthcare workers. And it really drives that sort of initiative where you're thinking, dealing with dengue really allows you to elevate the community and elevate the healthcare system. So we really need to get, so if anyone's interested in understanding how we can pull that together and how we can serve as an advocate in that area, then please get in touch.
Thanks, Kevin. And now I turn to Isabella Herrera, who is online. Isabella, I hope you can hear us. We've heard a couple of mentions of the Dengue Alliance, and it brings together a range of partners to accelerate and development and equitable access to dengue tools. From your perspective, how can partnerships such as this help move the agenda forward more effectively? One second.
Okay.
Sorry, we didn't have sound. Yes, we do now. Please go ahead.
All right. Very good. That's wonderful. So thank you, Michelle. It's a pleasure to be here, and sorry not to be there in person today. But essentially, from our perspective, and very much aligned with the theme of the session today, is that partnerships are not just helpful, but they are actually absolutely essential if we want to accelerate development and equitable access to dengue tools, right? We have this disease and the theme we are very complex, rapidly growing, and no single institution, no matter how strong, will be able to solve it, right? So there has been a lot of progress over the past decades with major advances in vaccines and innovation in vector control, but the progress in treatments have not kept pace. This gap is really one of the reasons the Dengue Alliance was created. And the idea is really to combine strengths, work differently, move faster into advancing evaluation of new therapeutic options for dengue, and making sure that these options would reach people who need them. So the Alliance brings together Fiocruz, Oswaldo Cruz Foundation from Brazil, Federal University of Minas Gerais, Sri Raj Mahidol University in Thailand, Ministry of Health of Malaysia, the Translational Health Science Technology Institute in India, and DNDi. So we're talking about leading scientific institutions, endemic country partners, public health agency, and DNDi is a PDP around this mission, shared mission, really to deliver safe, effective, accessible dengue treatments and working towards equitable access from the start. And the focus of the Alliance was really one of developing treatments that would prevent progression of dengue to severe disease and thus reducing the burden to health systems and society. The Alliance is organized through different thematic working groups. We have a preclinical and clinical working group. We have a translational and therefore diagnostics and biomarkers working group, and about epidemiology modeling and access and implementation work. And so all these groups really link expertise across different institutions, different countries, with the leadership from dengue endemic countries. And the Alliance is not advancing individual projects, but really building this coherent strategic portfolio, and also this ecosystem that enables research and development, bringing this to future impact. So a number of the themes that I heard from the different talks today is that there is this element here about partnerships, and this one that the idea is to align and bring fragmented efforts behind a shared goal. And therefore we have this common mission, a shared roadmap, and really ensure that our collective efforts are reinforcing each other and really working and aligning behind priorities, trying to reduce duplication, very much following what's happening, this evolving and dynamic innovation landscape now in dengue, and really to fill R&D gaps in a deliberate way and thinking ahead in terms of future delivery. There is this element here about that partnerships bring together multidisciplinary teams and expertise, and because developing treatments for dengue would represent not a single scientific challenge and requires this integrated cross-disciplinary response, and very much thinking in a way this will actually be deployed at the end, and particularly with other existing tools for control and reduction of disease burden. So it's really through partnership, really creating end-to-end solution, working with research, product development, thinking about operational delivery and policy work. And so it's really thinking on innovation that can become a lead to actual impact. And this, and for us, and in the Alliance and for DNDi, very much at heart with the work that we do, is really that really enabling equitable access from day one. And this is really not as an afterthought. So start from developing target product profiles that take into consideration assessment of needs with the perspective from endemic countries, ministries of health, communities, research networks, health system realities. So really working, because if product development happen in isolation from implementers, from ministries of health, tools risk becoming too complex, too expensive, and simply essentially misaligned with the context of use. So bringing endemic countries partners from the start, the Alliance ensure that hope to ensure that the solutions that we develop will translate into feasible, scalable, acceptable, affordable solutions. No, certainly not something to be retrofit later, but really embedding equity into innovation from the start. And all along speed and scale. Really, we have this rapidly evolving dengue landscape. And partnership allow us to share risk, pool resources, mobilize funding more efficiently, and really working in a coordinated way. So in close, I think essentially what we have in working as an alliance is that with dengue is such an important challenge, our response should match its urgency, and so it's really working together and looking
Isabella?
at the work ahead.
Isabella,
Yes?
I love your enthusiasm for this, but
I'll stop. I feel
thank
like
you. It is so. It is good to see a co-chair who's so enthusiastic about the alliance. But we need to move on, if we may. Thank you for this.
Of course. No, it's finished. Thank you.
So, if I now can turn to Marco, who is the Vice President of Innovation and Production at Fiocruz. We've heard from your colleague a little earlier about the key role that Fiocruz is playing in advancing the research and the approach to dengue, but also looking at local and regional production. And I think one of the things that was mentioned is you're also the secretariat of a new global coalition for local and regional production, innovation and equitable access. So what I wanted to sort of ask you is, how do you feel these efforts can contribute to a more sustainable and scalable dengue response?
Of course. Thank you. Good afternoon and good morning. It's also, I have to say that it is an honor. I'm also representing Dr. Mario in a different hat from his. He's the executive secretary of the Global Coalition. And Priscilla Ferraz, who is she's the vice president. I'm deputy vice president for production and innovation. So just to clear that Fiocruz is in this, you mentioned that the collective action in dengue is relatively new. The coalition is definitely new. It's very recent. We just shared the call for proposals 2 weeks ago. And I mean, it's a big effort. It was put forward in the context of the G20 during Brazil's presidency of the G20, and it stems from the hard lessons learned in the COVID pandemic that showed us that definitely where things are made really matters, especially regarding health products. So the idea of the coalition is to bring the production of health inputs, health products, therapeutics, vaccines, diagnostics, and systems for early alerts to epidemiologically relevant territories. This is something that we feel has been lacking in recent efforts, and we understand that it was a part of the global health system that had a gap, but also I would like really to stress that the Global Coalition has in its core a very strong idea of not superposing, not competing with already started initiatives. It is something that we regard very seriously. We understand that the Global Coalition could be a tool to better understand already ongoing initiatives and how they can strengthen each other, and for us to see which places of the planet have the specific needs and which kind of tools are better suited for those needs. So we also understand that applicants, this is very important, applicants can be from governments, not government partnerships from governments with the private sector. We have a very broad alliance made with the Global Coalition. I won't be able to mention them all, but I have to stress Pasteur Network and the DNDi, the organizer of these events, are part of the advisory committee of the Global Coalition. And the initiatives, they can be of mainly two kinds. The first, catalytic, of non-financial support, but this includes partnership facilitation, strategic alignment, endorsements, technical support of many kinds, and also potential financial support, as well as you have the most important financial institutions in the global health field as well. They are also part of the Global Coalition. They are present and they have a commitment to not necessarily to make the financial support, but to show the right ways to find these financial supports. So the idea is to have a global understanding of how the ways to put this forward. We have a big expression of this with the support done by the presidency of France of its G7 presidency. They are supporting very strongly the coalition as well, and we are doing a presentation regarding the coalition this week here also in Lyon. And also this, if you can, we strongly encourage, if you're not part of the coalition, if you show your phone to this QR code, it is you're very welcome to learn more about it, and if possible to join the coalition. And I think I covered everything. Thank you.
Marco, there's just one. Thank you. There is, I think, a call for proposals as well in this area. People have talked about interest. So, what is the deadline? If anybody wanted to,
the deadline is in 3 months. It started the first of March, and it ends on the 1st of July. So we have 90 days to complete it. And we are also at your complete disposal to learn more, to share any specifics. Will be available to anyone with more specific interests.
And this is a call for tools for dengue. So I think
yes, dengue is it was the main challenge. It was the inception idea was to focus on dengue as a pilot call. And it was finally, it was concluded. It was the ideal call to drive the first pilot calls, and it is the single one in the first call. So also, if I can share this, it's not a single aspect. Ideally, we would have a set of solutions focused on dengue with vaccines, therapeutics, diagnostics. The whole thing's pointed to a single challenge, and we understand that if this works, we can then have a modular system to develop these two other challenges. The idea is to have subsequent calls right after this one is ongoing.
Thank you.
Thank you.
Thank you, Kevin, Isabella, and Marco for these interesting insights. And please feel free to talk to people at the end. So now I'm coming towards the end of our meeting. I was asked to come up with key takeaways. I think we probably need an AI agent for that rather than for me. But I think a couple of things are really clear and common themes that have come out, which is that, you really need to adopt a One Health approach here. There are challenges of fragmentation, but the solution is integration. And we've seen that from the various ministers. It's about integrations between government departments. It's about integration and leverage of data, not just health data, but climate data and other forms of data. It's important to look cross-regionally. We were memorably told that, a patient in Kenya and a patient in Europe, it's a patient everywhere. And we're all facing similar challenges. And I think it was very heartening to hear from Hera that there's a recognition that there is much to learn from countries who have had a high burden of vector-borne diseases, and the importance and the self-interest in working together. I think the other point, which is really important, is that there isn't one silver bullet. There isn't one tool. We need to be looking at surveillance. We need to be looking at diagnosis, vaccines, treatments, and all elements of prevention. And I quite like the moving from an emergency response to a considered, purposeful response, which isn't just looking at future pandemics, but looking at responding to existing health challenges that people are facing. And most importantly, to see it from a patient-centered approach, a person-centered approach. And communities are not just people who receive tools, they are people who co-create and need to be at the center of the work that we do. So thank you all for your insights, which have been really important. And I think we end with another form of collaboration. We started with collaboration, and I think we continue with collaboration. And so I'm very happy to welcome again Dr. Barbosa and Rebecca to come to the front, where they will be signing an MOU between PAHO and the Pasteur Network. And I think the signature reflects a shared commitment to strengthen preparedness and response through a One Health approach. So please, I think this is also an opportunity for us to witness in real time a new collaboration. Yeah, yeah. You're welcome. Hang on 1 second. 1 second.
Bonsoir tout le monde. Good evening to everyone. My name is Sylvain Ligueri. I work for Pan American Health Organization. And at this moment, I'd like to take advantage of the presence in this room of old friends to tell you some field stories and why a document signed between the Pasteur Network and the Pan American Health Organization is so important, because it's a long due document, really. I'd like to give you two examples. We have Amadou on this side of the room, and when Amadou, during the mid-2010, was in charge of the director of the Institut Pasteur Dakar, we had this emergence of Zika in South America, starting in Brazil. And Zika was new for all of us. No country had the capacity to detect Zika. And the technology and the training came from the Institut Pasteur Dakar au Senegal, with Amadou deployed to Sao Paulo with USP and Fiocruz and working directly with. So it's one of the first examples that we have. We have many, but Amadou being in the room, I'd like to recognize his support at this moment. Monsieur le Ministre, Monsieur le Ministre du Sénégal, l'appui de l'Institut Pasteur de Dakar au moment de la crise du Zika dans les Amériques a été très important pour nous tous. And the second example that I would like to use is a very recent example. You know, the many institutes of the Pasteur Network and members, including Fiocruz, including Guadeloupe, including Cayenne, are part of the networks that are coordinated by the Pan American Health Organization. And you may be aware that during the last month, we have an upsurge of chikungunya in the Americas, including in Cuba, and more recently in countries of the Guyanese Shield. And Suriname was heavily affected and still affected by a huge outbreak. And with, let's say, less laboratory capacities than other countries of the region. And the genomic surveillance, the genomic characterization of the chikungunya outbreak was done at the Institut Pasteur de Cayenne with Christophe Perfit. So we have in this room two partners that are providing with direct technical assistance during crisis. It's why, again, the signature of this agreement is a long due agreement between the Pasteur Network and the Pan American Health Organization. Thank you.
Thank you. It's a good reminder that the other important element here is people, and it requires all of us to continue to show up and to share our knowledge and to work together. And it's good to be reminded that some of those people have been working in this area for a very long time. So thank all of you who have shown up today, both here and online, to be part of this important conversation. I just wanted to highlight that obviously dengue is an ongoing conversation, including here. And so tomorrow there will be another side event with from the WHO and CEPI, which will begin at 8 o'clock tomorrow. And it will be a sort of continuation of this. And there are representatives from the WHO here, I think. And please go and speak to Anna Maria, and she can tell you more about it. So Excellent, thank you. And so I'd like to now bring the event to a close. Thank you very much for your participation to all of the speakers. And I think we now have a traditional photo at the end. But please, those of you, stay if you want to talk to some of the panelists as well. Thank you very much. And I look forward to seeing some of you in the rest of the time here. Thank you.